found in the kidney, and one of its pure hormone is the renin, which has an effect on the decrease in perfusion. Renin stimulates RAS or angiotensin-aldosterone system, which then just converted into angiotensin 1 and angiotensin 2 into the liver. This angiotensin 2 will stimulate into the blood vessels, causing vasoconstriction. Angiotensin 2 will stimulate the endothelial cells. Angiotensin 2 and endothelials can cause vasoconstriction, especially in the main arteries and veins. Vasoconstrictions may maintain blood pressure, but it has a maladaptive activity. Since the weakened heart will pump harder. As it pumps harder, it increases resistance, causing vasoconstriction may impair the circulations of oxygen into the myocardium. From this constriction, it may also distribute the displacement of fluid into the lungs. Angiotensin 2 stimulates kidney to release aldosterone. Aldosterone causes sodium and water retention. If the left ventricular emptying is impaired, there will be increase in residual blood causing increase in pressure. Increase in pressure may result into a backflow from left ventricle to the right, from left ventricle to the left atrium. From this, there will be increase in residual blood causing the accumulation of blood into the lungs. Since there is accumulation of these bloods into the lungs, so there will be a backflow causing pulmonary edema. Our patient manifested unproductive cough, dyspnea, and crackles. This is represented to you the left-sided congestive heart failure. From pulmonary edema, there will be increased pulmonary vascular resistance, causing increase in right ventricular contraction, causing increase in pressure. Thus, in increases pressure of the right ventricle, it may result into stress and hypertrophy. The increased stress of the hypertrophy may impair or decreases the emptying ability of the right ventricle, causing the increased residual blood in the pulmonary. The decreased emptying of the right ventricle will increase its pressure, causing a backflow from right ventricle to the right atrium. From this, there will be increase in residual blood, causing increase in pressure. Increased pressure in the right atrium may result into an increase in venous pressure. Increase in venous pressure may be manifested with jugular vein distension, in which our patients manifested. Increase in venous pressure may lead into increased fluid systemic venous circulation, thus increases the fluid into the distensible organs. And one of these distensible organs that may be impaired is the liver. The liver. If there will be intra and extrahepatic obstruction, there will be accumulation of bile. Since there is an impairment of the excretion of bile, it may result into an autoimmune destructions causing, from this, since there is an accumulation of bile, there will be a staining of bile causing fibrosis. From these fibrosis, this is maybe due to the liver parenchymal destruction. This is brought about by the macro and macronodules formations. These macro and macronodule formation is maybe due to the liver parenchymal destruction brought about by the obstructions of the body excretions. From these fibrotic tissues that may result due to these disruptions, so it may result, since there is a fibrotic liver tissues, there will be obstructions of the venous flow. From this destruction of venous flow, there will be increasing congestions, causing portal hypertension and liver cirrhosis secondary to congestive heart failure, secondary to atrial fibrillation. Patient manifestation. These are the signs and symptoms that our patient manifested. Shortness of breath, palpitation, chest pain and discomfort, weakness, yellowish discoloration of sclera, ascites or distension of the abdomen, edema at ankle feet. Patient not manifested. Fatigue, nausea, loss of appetite, loss of weight, jaundice, and itching. So what will happen if there will be medical and nursing interventions? First is the diagnostic state, which includes physical examination. During the admission of our patient, he has been undergone physical examinations by the physician. This also includes the complete blood count, the electrocardiogram, which includes the electrical impulses of the heart, the record of the electrical impulses. This also includes the stress test, the two-dimensional echocardiogram. On the other hand, which is not related, the chest X-ray posterior anterior, since our patient refuses the SGPT and SGOT, or the serum glutamic pyruvic transaminase and serum glutamic oxaloacetic transaminase for liver functioning. Treatment. This includes O2 inhalation at 4 liters per minute. Limit oral intake into 800 liters. Double the 250 cc from 10 ml, then change into 20 ml, then 30 ml. For the coronary bypass, which is not related to our patient, and the heart valve repair. For the medications, this includes the classifications, the nitrate, the diuretics, the cardiac drug, and which is not related to our patient, the ACE inhibitor, beta blockers, and the digoxin. For the nursing implications, assess client's vital signs, assess pain characteristics, onset and duration, and its frequency. Monitor intake and output from all sources, per oral and intravenously. Maintain complete bed rest. Maintain effective ventilation by maintaining oxygenation. Elevate head of bed. Elevate epimatous extremities. Assist in repositioning and demonstrate deep breathing exercises, and instruct to eat nutritious foods within the client's limit. If these nursing and medical interventions may instituted, it may result into an optimum organ functioning that lead into good prognosis. On the other hand, what will happen? In the heart. If the heart increases its resistance due to the neurotransmitters and due to the neurotransmitters that was produced, there will be a vasoconstriction causing impairment of the oxygen into the myocardium, for the cirrhosis and portal hypertension. Due to the fibrotic liver tissues, there will be obstructions causing bulging of the esophageal varices. This bulging may result into rupture if not medically intervened. If this bulging will rupture, it may result into bleeding. So there will be a bleeding into the esophageal varices. This bleeding may include internal hemorrhage, causing hypovolemia. Hypovolemia may then result into shock. The compensated shock may result into tachycardia, tachypnea. On the other hand, it may also result into hypotension, whereas the irreversible damage of shock can cause cell damage, especially in the liver and in the kidney, and irreparably damage or repair of the vital organs.